ask you a question. Have you all filled any customer satisfaction survey for any product? None of you? You don't care? Okay, you did.
Just to sort things off, I bought enough line now. Either I was incredibly impressed with or incredibly upset with.
Yeah, like all surveys, including teaching evaluations, we either fill this out when we like the course or we hate the course. I've been young before, I know. And in my time, it was paper and pencil. I had no choice, actually. When I was in grad school, it's online, yeah. Okay, I'm old. I'm 47, I'll be 50 in a few years. Yeah. So it's the same, like any product. If it works like crap, then I'm going to fill a survey out because I'm angry. Good thing the dean moved to Thomas. I can use swear words and record it. I'm in trouble. The e-campus will know. What's your name again?
Sorry, say again?
You just answered.
Yeah, I'm sorry.
What product did you survey?
I think there was a flashlight that I've done before.
Flashlight.
That was really bad. And I think I bought a hammock, and I like the hammock, so I reviewed it well.
It doesn't work at all. It works like crap.
Well, yeah, the flashlight, I think the cap had fallen off, in the box when I got it. And then I tried to ask for another one, they just sent it back saying it was my fault that it broke. And I'm like, well, it came like this.
They blame it on you.
Yeah.
So you give a crappy survey.
Yeah, I said some nice words to him online.
Okay. Do you know how to operate a flashlight, right?
Yes.
Okay, I'm onto something here. I'm not insulting your intelligence. Okay, anybody fill out a survey for any product or any service? Just one person in the whole class? Okay. What product?
I get a meal delivery box every week because I don't want to go grocery shopping.
Uh-huh.
And then they'll send like various things. At one time, like the broccoli was like really gross, and like a couple things were really gross in it, and it was like not good produce.
Oh no.
So I had to send them like a review on that.
It's not from Hy-Vee, right?
No.
Hy-Vee is different.
Yeah.
From my experience, limited experience. So you gave a crappy survey. And you are familiar with your groceries, right? Yeah. Anybody fill a survey for any product? Okay.
Like going out to eat and then they'll ask you to rate your service, like how well your waitress or waiter did, how well the food was, and things like that.
So you are familiar with the restaurants, their menu, how the food should taste like, comparable to other restaurants, and you gave a bad survey too. Did you go back to that restaurant, or
No.
you're afraid? Yeah, we know why. Anybody, any other volunteer? Just 3 of you? Okay. So all of you, the 3 of you, thank you. And you indicated that you are familiar with the service and product, your grocery or flashlight, or the menu, how the food should be cooked even. But in healthcare, patients also have to fill a survey. These days, I don't know if you realize that. Because they focus on patient-centered healthcare. Does that ring a bell? This is the new trend. They focus on patient. Make sure patient is happy. Patients are safe. Minimize the risk for patient and what else and what not. And because of that, patients after inpatient or outpatient care, they have to fill out survey. I don't know if you've been through that or you're too young. You're still healthy. And is there any similarities and differences between healthcare and the products you buy? The surveys, are there any similarities or differences? We all have to fill out surveys when we buy stuff. When we use a service, when we go to the hospital, that's a service too, but a different service, not like restaurants. So are there any similarities and differences among all these different types of survey? Yeah.
It affects the service or the product that a patient or consumer will choose to purchase.
But for the products or service we use, not hospital, it has something to do with the characteristics of the products and service too. When we fill out any survey, right? Okay. Let's go to something different. Who is a social major here? Very few people. So you are not familiar with this person, Irving Goffman. Lucas, you were in my Social 101, right? We talked about this guy. Maybe it's too long ago.
Yeah, it was a little long.
Okay. So, Irving Goffman is fine. It's not on your exam and it's open book anyway. So, if you scroll down, it says that the hospital setting can be explained using this Irving Goffman dramaturgical theory or dramaturgical theory. Irving Goffman constructed this theory centuries ago, extracting ideas from Shakespeare's. I'm sure you know Shakespeare's, famous guy. And Shakespeare wrote a lot of plays, right? When it comes to play, it has a front stage and a backstage, right? So, hospital has a front stage and a backstage too. I don't know if you realize that. And somewhere in this article, yeah, right here, this is recorded and I tested yesterday, it works. Hopefully it works. The government says that we should focus on the patient. We should emphasize patient-centered care. Because of that, patient surveys are booming like mushrooms. But have you all seen the survey questions? Maybe you're too young and healthy. Good for you. And this article, the authors claim that the questions asked in this survey, they focus on the front stage of the hospital. The ambience, the music, the decoration, the cleanliness. They rarely focus on safety aspects, technicalities of first responders. That's important, right? It affects patient care, patient safety. How good are the first responders? Expertise, knowledge of physicians, nurses, pharmacists, paramedics. Survey questions on patients rarely focus on those. Those are the backstage. So, according to this article, the hospital setting can be analyzed using Irving Goffman's front stage and backstage theory. Dramaturgical theory. Our life consists of a front stage and a backstage. This is the front stage in class. We all act professional. And at home, we relax and unwind in your dorms at home. You are more casual. That's your backstage. You are your true self. That's your backstage. We engage in impression management when we are at the front stage. Do you think I use swear words or words close to X-rated or words closer to PG-13 when I interview for this job? Do you think I use swear words when I did my teaching demo? Do you think I talk crap like what I just did? No, I was on my front stage when I interviewed for this job in 2017. I tricked all the deans, the chancellors, my chair, my colleagues to give me this job. I was on my front stage. I engaged in impression management. They think that I'm innocent and good, even to this day. Good thing the dean moved to Thomas. His office was just across the hall. I would be on my front stage if he was still here. So that's the gist of Irving Goffman's theory. For those who had Soc 101 or Intro to Soc, in here or elsewhere, you transfer in, doesn't matter. Does that ring a bell or is too long? Too long time ago, it doesn't matter. So, their concern is that hospital, they focus on having a garden, ambience, having the correct paint color, correct lightings, and whatnot and what else, beautiful paintings for patients to enjoy. Delicious food, not so much nutritious food, based on the patient's health conditions. That's the front stage. All these satisfaction survey focus on the front stage. If that's the case, we got a problem in here. Survey question really asks the technicalities of the doctors, nurses, paramedics, first responders. Those are equally or even more important, right? So these are the problems in healthcare. When they try to focus on patient-centered care, maybe hospital, they try to survive, so to speak, or compete with other hospitals nearby. They focus on the soft side, paintings, ambience, music, garden. They downplay technicalities, expertise, knowledge of health professionals. Rarely there are any survey questions on those. And even if you ask survey questions to patients, do you think the doctors are knowledgeable when he or she was giving suggestion, treatment, diagnosis, prognosis? Do you think the patients can fully answer those survey questions? Why not? Very good. No, not fully. If we ask survey questions like this, do you think the patients can fully answer those questions? Do you think the doctors, nurses are knowledgeable, knows about your predicament, disease and whatnot? Do you think patients can answer those questions? Do you think patients are all the same? They vary. They vary by sex or gender, different sexual orientation with different needs. They vary by different income level, right? Different occupation. And people's insurance status depends on people's income and occupation, right? Not all jobs comes with insurance, we know. So, what determines people's income and occupation status is a common sense question. What determines people's income? Yes?
Their level of education.
Yeah, education. And aside from education, what else? Very good. Where do we learn stuff? How do we learn stuff? Experience, previous experience, very good. So if the patient had a previous experience from another doctor, from another hospital, or the same hospital, patients may be more able to answer those surveys about expertise of doctors, right? Just like educated patients are more able to answer those surveys when they see questions about knowledge, experience, expertise of doctors in giving treatment, suggestions, and diagnosis. But not all patients are alike. We all know that. And can you see, since we've been through some discussions so far, can you see how patient satisfaction survey is different from the surveys you did for your services and products? Are they similar or different? Yes,
They're different.
different.
Yeah. Well, because when you're rating a product like a flashlight, you're
Mhm.
actually rating what it does because you
Mhm.
know how to operate a flashlight.
Yeah,
And it's hard to rate a brain surgery when you are away and you don't know how to do brain surgery.
and very good. Not everybody knows what is enzymes, what is ACE. Two, what are certain proteins, how they interact with the environment to affect health outcomes. If they are educated, they know. And if a patient, I'm not making this up, if the person has a PhD in biochemistry or biology, or even degrees in health science, sometimes the person knows, I don't want this medication, can you change another medication for me? Can all patients propose this to the doctor? Are all patients aware of the dangers of the prescriptions or implications of the service rendered to them? Not all, we just been through. So, and flashlight, they are always user manual. So if people have not operated a flashlight before, they can read the manual in most instances. But for services in hospitals, sometimes, like what you all just say, our health conditions, diseases, sometimes they may be too complicated. Even if we consult Dr. Google, they are still technical sometimes. In these days, sometimes it's good. They try to say that in layman's terms in many websites. I'm sure you realize that. WebMD, other platforms, they try to explain all these illnesses in layman's terms. But still, it's hard to understand. And sometimes, I'm sure you've seen medical forums, right, in this day. Sometimes people, they don't use their real name when they go to these places, right? They use their avatar, right? So that nobody knows who they are, which is okay. Yeah. We should protect people's privacy, the HIPAA law, right? I'm sure you know. And they use avatar or user ID, we don't care. They ask about certain things, about certain symptoms they experience. People answer them. But still, in my humble opinion, they don't get a complete understanding about what's wrong with them. Not 100%. Can you agree with me? Even if you can ask Dr. Google, you can go to online forums, medical forums. And maybe some people who responded on these forums, they are MDs, DNPs, from D, and whatnot. So, that's the main difference, according to this article, between a survey for any product or service we use and a survey for patients. Can you see that? Even if hospital, they want to be honest, they're being nice, being honest, have the patient's best interest in mind. They ask patients to rank the technicalities, knowledge, expertise of health professionals, doctors, nurses, pharmacists. Not all patients can do that. So that's the problem. And a second point from this article is that hospitals these days, they are privatized. Even if they are not privatized, they want to generate profit and minimize costs. Like many capitalist entities, even if they are non-profits, they don't want to make a loss. And because of that, it affects how they wrote their surveys. They focus on the front stage. the soft side, ambience, paintings, air conditioning. They downplay people's expertise and knowledge. I'm done with this article. Any more question, comments? You don't have an exam question from here. Because I know it is the first week of class. And you are still floating around. You check me out, I check you out. And you want to make sure whether I'm crazy or not. Because I use words very close to R-rated, X-rated, far, far away from PG-13. You want to check out whether I'm crazy or not. That's fine. So, because of that, I know this is before the drop add period. So, you don't have an exam question, unfair. Any question? Okay. Let's move on to something else.